including all the things that Dr. Aaron talked about, prayer. Nobody's going to raise their hands. How about this? Anybody think it's optional? Come on, you be honest. Is everybody here under chiropractic care? Every single one of you are? No, I see some heads turning. Okay, so, but you don't think it's optional. So, okay, that's cool. We can move, we'll get through this, okay? But I want you to understand why it's not optional. And Dr. Aaron started off talking about your nervous system, okay? The supremacy of the nervous system. It's a fact. It's a fact your nervous system controls everything, all right? You can look in Gray's Anatomy. It's right in there. You can go to any medical doctor. They will actually tell you that. And your nervous system is responsible for receiving, integrating, and distributing everything, all the information. You've got like 75 trillion cells in your body. You know how in the Bible it talks about how we are the body. Every person makes up the body of Christ. Each one has their own gifts. Your body works the same way. Your heart cells literally communicate with your liver cells. They work together. You can't separate your heart from your liver. Your whole body works together. That's what holism, that's what holistic is. Okay? So for you to see me right now, for you to hear me, for your heart to be beating, for your stomach to digest your dinner, the last time you smelled the rose on Valentine's Day. Okay? You know, this morning I get to kiss my boys before I came to work, the feeling of that. Everything you've ever experienced is because of your nervous system. Everything. So, do you think it's pretty important? Okay. Absolutely. So what is your nervous system? It's made up of the brain, okay, the spine, the spinal cord, you should say, and the spinal nerves. Okay, so that's your nervous system. And here is the big idea. Chiropractic, we always call it the big idea. The big idea is this. Blah, 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 blah. This is what you're reading right here. Chiropractic's purpose is to restore and maintain proper spinal motion, alignment, posture, in order to restore and maintain healthy spinal tissues and healthy nerve flow between the brain and the body. I've read that 1,000 times, and I always people do think, okay, what? You know what? We'll dive into this a little bit more, and I think it's going to make a lot more sense why this is critical. So why is the big idea important? Because this is what we're finding out. Decreases in spinal motion or movement and abnormal alignment and posture. This is the point where everyone sits up straight now. Always results in spinal bone and tissue decay and degeneration and unhealthy spinal nerve flow. Always. That's a strong word. But this is not me saying it. This is coming out of tons and tons of research. I'd have to give you books in order to relay it to you. Always relates in decay and degeneration. When you think of decay, what do you think of? Rotting. Okay. Tooth decay. I guarantee most people in this room are getting their teeth checked regularly. Right? The scientific term for this devastating nervous system condition is called a vertebral subluxation. Okay, that's the big fancy word that we use. And I think it's important enough that I'll use it often tonight so you can try to remember it if you don't already know. Vertebral subluxation. Vertebral, vertebra, okay, bones of your spine. Subluxation. Sub means less than. Luxation means this is less than a dislocation. Okay? That's kind of how we look at it. It literally means, though, if you kind of go back and take the words apart, it means less than divine light. I think it's pretty interesting when you're thinking of how energy in your body works through your nervous system. Less than divine light. Less than enough nerve energy is getting through your body. So, again, improper spinal motion and abnormal alignment, which causes inflammation and decay in the muscles, in the ligaments, the discs, the tendons, you name the soft tissue around your spine, and interfering with proper nerve function. This is kind of a schematic that shows here we've got nerve, your spinal cord is in here, the messages from your brain are coming down and going out through the nerves to your organs. Heart, lungs, liver, kidney, you name it. Subluxation, can you see how that nerve is kind of shriveled there a little bit? Okay, so that is kind of a little schematic of what a subluxation looks like. When you have a subluxation, two things are always going to occur. The first is we've already talked about spinal decay, like tooth decay. It literally is rotting in your spine, They call it, when it's advanced enough, they'll call it osteoarthritis. Okay? You can see it on an x-ray. It looks like claws that are coming off the bones. And that's what it is. It's a claw-like structure of bone there. But the other thing that happens is that these discs, which are your shock absorbers, they begin to get thinner and thinner and thinner, and they wear out. I just talked to somebody today, a patient of mine. She said, you know, my sister is going in, she's in her 40s. My sister is going in next week to have 3 bones in her neck fused. And she said, is that a bad thing? To me, that's horrific. You'd be better off having open heart surgery than having that. Because if that happens, you've lost motion in those joints there. And that's your spinal cord, that's your lifeline you're talking about. The second process that always occurs, bear with me, toxic amounts of sickness-promoting stress nerve signals, okay? Called nociception. I don't care if you remember that word, but I'm going to just help you to remember kind of, when you think of noci, think of N, negative, okay? Negative body signal. And so toxic amount of negative signals and deficient delivery of energizing, health-promoting nerve signals called proprioception, P for positive, okay? So, toxic amount of negative signal and deficient or not enough positive messages, okay? We'll dive in more so you understand it better. Let's talk about decay and generation first. So, this is just a picture here of showing, like I said, x-ray, normal x-ray here, bones of the spine, nice, thick, healthy disc. Over time, though, okay, this person had a subluxation that went uncorrected, okay? For a while. By the way, research is showing that we're finding this in 10-year-olds. This is not a disease of old age, okay? We used to think this is old age. We're seeing this in 10-year-olds, and we'll talk more as our population sits more and more. That's why, okay? So mild arthritis or decay is occurring. The disc space is a little less. You're getting some bone spur in there. It's like that little claw. It continues on. Again, uncorrected, moderate arthritis. Can you see the claw there? It's kind of far away. That's a bone spur. Okay? The bone here is literally reaching down and going to be trying to fuse with the one below it. That's what happens over time when you don't get subluxation corrected and eventually severe arthritis. And it doesn't take a chiropractor or a radiologist to look at that picture and to say that doesn't look good. Do you agree? It's not healthy. So it can cause pain, it can cause weakness, it can cause fatigue. You lose proper posture, mobility, balance, and so on. But most often, just like these other silent killers, heart disease, diabetes, cancers, you know, we all know people who found out they had cancer and felt great. I certainly have. We've all probably known people who thought they had a clean bill of health and they dropped dead of a heart attack. Okay? It's the same way with subluxation. They build slowly over time without any symptoms in most cases. Unless, for example, you're in a car accident and you have like a whiplash or you fall off a ladder or something. You can see where that would cause something instantly. This is something that develops over time. Okay? So you wouldn't know you had it. Okay, I'm just going to go through these quick here. These are just some of the negative effects of decay. I'm not going to read them all. They're in your notes there, but decreased muscle mass, okay? 20% loss of muscle strength per week when you have subluxation.